Hello everyone, once again. You're welcome on the program Health Matters. Thank you for joining me today. My name remains Labake, also known as Elizabeth. On today, we are doing the 16th edition of Health Matters program. Like I always say, we always bring the topic to our viewers wherever you are, according to the needs. So today we are treating and we'll be discussing diabetics. On the show, I've got Dr. Adams. Do you want to please introduce yourself to my viewers?
Hello everybody, my name is Dr. Adam. I have a background in emergency medicine. I did that for 6 years. And now I'm a GP. I've switched into GP in general practice. And it's a pleasure to be here. Thank you so much for inviting me to the show.
Thank you so much. Please share this video. And like I always say to people, we're going to discuss within 30 minutes. And after 30 minutes, you can call in. We'll be giving out the studio number to call so that you can ask questions. It's a privilege to have a doctor on the show today. And as we all know, diabetic is a major significant physical problem that we battle this day. A lot of people have it already and they're trying to manage it. And a lot of people, after the checks, they still have traces. So today we'll be discussing, if you have the diabetic already, what can you do to manage it well? If you don't have it, if there's still traces, what can you do to ensure you don't even have it? So Dr. Adam, when we say diabetics, what do we mean by diabetic?
So I think the first thing we need to think about is what happens in the body naturally. So when we eat food, generally, like a meal, we digest that with the stomach, and then we break that down, it goes into the intestines, digestive system, and then that's broken down into sugar, which goes into our bloodstream. So the normal body reaction to blood sugar in the bloodstream is that the pancreas, which is an organ just behind the stomach, that releases insulin to help draw the sugar into the cells, which the body needs for energy and to do processes. So what actually happens in diabetes is that process is interrupted, and that's because, for several reasons, depending on the type of diabetes, but somewhere along the lines we cannot get the sugar from the blood vessels into the cells, so it remains high in the blood vessels, and that's what causes the problems. So that's what diabetes is.
Oh, that's actually a good explanation for people who are not in the medical line. Thank you so much. So if someone has, what are the causes actually? Well, before we even go into the causes, what are the signs and symptoms that you need to watch out for? That because some people wouldn't even know until it becomes type 2, type 1, whatever. So what are the signs and symptoms one needs to watch out for?
So it's an interesting question. The symptoms are a lot stronger in type 1 diabetics because they have no insulin. So in type 1 diabetes, that happens usually at a younger age, under 40s, usually teenage years, and you will get quite severe symptoms because you have no insulin at all produced. Because in this condition, it's an autoimmune condition, the body attacks the cells of the pancreas that produce the insulin. So the sugar just goes to very, very high levels, and that will cause the symptoms which I'll come on to shortly. In type 2 diabetes, there is insulin being produced, but the problem is it's getting resistant because the sugar levels have been remaining high for so long, the insulin's not working as it should. So the symptoms will be a lot milder than the type 1 diabetes. So in diabetes generally, the main symptoms you get, because of the high sugar in your blood, is you get a lot of passing water. So you pass urine quite a lot, going to the toilet. The reason being is you have a high high sugar level in your blood, and you need to get rid of that. The only way to get rid of it is through your kidneys. So that's why you end up going to the toilet a lot. As a result of that, you also get quite dehydrated because you lose water. So thirst is the next symptom you would get. So thirst and going to the toilet a lot are the very, very common symptoms. As we mentioned before, in terms of the sugar in the blood going into the cells for energy, for the cells to work properly, if that process is not happening, you will actually not get energy into the cells, so you'll feel very tired. So tiredness is another action, and in type 1 they actually lose weight, people, because you're not actually using the sugar to store into the body, so you actually will get a lot of weight loss. So there, to summarise, they're the 4 key symptoms I'd say. So passing water a lot, increased thirst, and in type 1 more so, you get a lot of tiredness and you can lose weight.
Thank you.
I hope that answers your question.
Yeah, sure. Thank you so much. So when you say passing urine, you know, like one can be actually passing urine, and at what point do people need to get concerned? And obviously some people get tired as well, isn't it? So at what stage? Because some people get tired and sometimes it could not be diabetes. So at what stage do people need to start getting worried? And then what do they need to do?
Right, well, tiredness is a very common symptom. It presents to the GP quite a lot, and there's many causes. So if you do have a symptom of tiredness which persists, I'd say probably longer than a couple of weeks, 3-4 weeks, it's worth going to the doctor to have some general blood tests. And a diabetic check or a urine sample can be taken. If the urine sample has glucose in, which is sugar, that's a very good indicator that you may have diabetes, and they may go on to do blood tests. So I would recommend if symptoms persist for over 2-3 weeks, that's when you should really go to the doctor.
Okay.
I recommend everybody should have a checkup at the age of 40, and in this country we do that. We do a well man check or a well woman check at the age of 40 just to check for this, because type 2 diabetes can be very subtle. You may not know you have it. It's not, you have some insulin there, but it's not working as well, so it's very subtle, not like type 1 where you would feel very, very tired. In terms of passing water, you get worried if you're passing, I mean, good amount, if it depends how much you're drinking really, but you need to think, if you're passing maybe over 8 times a day of passing water, I'd say that's probably a good indicator that it could be diabetes. But it's the combination of symptoms really that make the diagnosis.
All right. Thank you so much. So for viewers listening at home, I think the doctor has actually made it so easy that he's actually not using medical terms to confuse people, which is really good. So he's actually communicating in a very layman language that you don't have to be in the medical line to understand. So what he's saying in essence is, if you're going to toilets constantly, like 8 times a day, then you need to be conscious and careful and think, is everything okay with me? Then he also said, obviously when you're going to toilets, you're passing urine constantly, you're going to be thirsty. So that means you're going to be drinking more. And some people, the reason why I asked the question was that some people don't drink a lot.
That's true, yeah.
Isn't it? So some people don't drink a lot, and they sometimes they don't have anything. But even if you're not drinking a lot and you realize you're going to toilet, then obviously people go to work and they're tired. So saying being tired is part of a symptoms, but he said when you're 2 or 3 weeks and you're constantly getting tired, then you need to ask yourself, is everything okay? And he does recommend earlier on that you need to be checking. So is there a particular test for diabetes, or you just go to your GP and say, I want to do a normal test, a blood test?
Yes, there is a specific test for diabetes, but probably the easiest way for the viewers, if they wanted to check they have it, would give a urine sample. If you're passing a lot of water, it can mean either 2 things. It can mean a urine infection, so that sample can be tested immediately. It takes 1 minute just to find out if there's a urine infection there. Or you can check for sugar in the urine. Now, if you're passing a lot of urine because of diabetes, there will be sugar in there. And so that's a very good marker to see if you're diabetic. If there's no sugar in there, you've not got diabetes.
Sugar in the urine.
But if we call it glucose, that's the medical term. But if you had there are specific blood tests for diabetes, but obviously that's a bit of time to wait for the test, to get the test to process it. If the urine has sugar, I would say recommend doing the blood test. That's when we move to it. So the test that we do for diabetes now is what we call a HbA1c. We look for the hemoglobin, which is the blood carrying cells in our body, which causes anemia if you go low. We look for those cells with the glucose on them, and it gives you an average of what your sugars are for the last 3 months. So for diabetics who are established, it's a very good monitoring process to monitor them every 3 months to see how their control is, because they may come into you once and not eat well, and you might get one-off reading. It's not going to be accurate, but if you take this blood test, it shows what they've been doing for the last 3 months. It's a good way of monitoring that, and we use it now for diagnosis as well. So
that's actually a good one. So we've actually talked about the signs and symptoms. You mentioned earlier on, Dr. Adams, you said the signs and symptoms is a bit different from type 1 and 2.
Yeah.
So is that the symptoms you mentioned earlier, is that for type 2 or for the...
It's for both of them, but if you can imagine, in a type 1 you have no insulin.
At all.
So the sugars go to extremely high levels, and you cannot use that sugar. So that you can imagine you have extreme tiredness, you're going to the toilet a lot, and you're very thirsty. For that reason, in type 2, when you first start getting diagnosed, you have some insulin there.
Okay.
It's just not working as well.
Okay.
But if we leave that for long enough, it'll end up like type 1 and then you'll have severe symptoms. So it's a very, very slow process in type 2.
So if I understand what you're saying, so if someone did not pick up the diabetic on time when they have it and they did not get treatment on time, so it could lead to type 1.
No, it wouldn't lead to type 1,
Okay.
but you'd have similar kind of problems.
Okay.
So the resistance could become so bad, you might as well have no insulin. Does that make sense?
Okay.
In type 1 has no insulin
At all.
because the body's attacked it. So you can't produce that. So type 1s have to go on insulin. There's no other medication for them other than insulin. In type 2 diabetics, most people start on tablets.
Okay.
Because we're increasing the sensitivity to the insulin. It's there, but we're trying to make it work better.
Okay.
But if it gets very bad, then type 2 diabetes, like much further down the line, they eventually go into insulin as well. Does that make sense?
Of course.
Yeah.
So for viewers at home, we're going to go into the causes now of diabetics, because I'm not sure. I'm a community psychiatric nurse. I'm not into much of the physical issues. So, but you can start calling in as soon as you want to ask any questions till the show. So this is actually a sensitive topic that everybody in one family, you realize there's one person suffering from diabetes. I've actually, according to the research that was done, you realize most people, a lot of people. So I'm not going to stop anyone from calling. As soon as you want to call in, you can start calling in. The number to call in is 0774 3475 356. I'll repeat, 0774 3475 356. So because what I've experienced is that after all your explanation, people who are just joining in will still come and ask everything, the same question of what you've. And so it's good if anybody wants to call in and start asking questions. Please, if anybody on the admin page can type up the number, please. Thank you so much.
I will just mention, we mentioned about the classes of diabetes, type 1 and type 2. The part that we're interested in really is the type 2.
Okay.
That's the one that's caused by, obesity and, poor diets, poor lifestyles, and also family history. Type 1 takes a very small percentage. So I don't want to focus on that. It's probably about 10% of all diabetes. The other 90% is the type 2. And this is a problem that's developed much more modern, in more modern times. It never used to be there because of our lifestyles. So there's a lot we can do to reverse it.
Let's talk about that. I'm interested in that. So in terms of diet, okay, so what are the causes actually, before we go into the diet aspect of it? So what are the causes? Why do we have diabetic? Why do we have to have a blockage in the bloodstream? Why do we have to have any stoppage or anything? What causes it?
So the cause of it, well, type 1, as I mentioned, is no insulin because the body attacks itself.
Body attacks
it's
itself.
called an autoimmune condition. So have you heard of rheumatoid arthritis, which affects the joints? It's the same.
Yeah. Okay.
So rheumatoid arthritis attacks the joints of the hands, attacks the joints of the knees. This attacks the pancreas specifically. So you get that at a young age. It usually develops, and you need to be on lifelong insulin. But I'll put that aside. Let's talk about the type 2 diabetes.
Which is more common in our society
More
now.
common. This is the thing that we need to target in terms of promoting health. So type 2 diabetes, if you can imagine, when you're overweight, which is one of the key factors of causing diabetes, is being overweight, and poor diets, that's caused by as well. When you've got high large amounts of fat on the body, you can imagine that the insulin cannot draw the sugar from the blood into the cells because there's fat there. So imagine it as a key, trying to put a key to unlock the door, and there's some barrier there. You can imagine that the fat. You can't get it in, so it can't get the sugar into the cells. Some of it gets in, but not all of it. And obviously the more weight you put on things, the worse it may get. The other thing you can think about as well is regarding the sugars. When we have a lot of sugary foods, cakes, fizzy drinks, all these kind of things, your sugar jumps very, very high in the bloodstream very quickly.
Let's slow down, please. Vio, I want you to listen attentively to this point. So in type 2 diabetes, the doctor is saying obesity is actually a risk factor. So if, for the people who are actually really on the bigger side, and you're fond of eating cake and fizzy drink, when they tell people, say, oh, I can't come and kill myself, Jerry, I'll eat. And this is what it results into. when you actually are not eating the right food, you're taking too much of carbohydrates. Nobody's asking you not to eat, actually. Let's not get it twisted. Nobody's saying you shouldn't eat, but eating the right food is what we're talking about. So I want you to re-explain the what you talked about, the obesity, how it affects diabetic.
So yes, I mentioned, so when you're obese, so you have more body fat on your body, that is a barrier really to, it causes insulin resistance, it prevents the insulin working properly. So the insulin may be there in good numbers from the pancreas, but it can't draw that sugar into the cells because there's a blockage because of this fatty tissue. So when you actually lose weight, you can actually help the insulin work better. So exercise helps that as well. The other thing to mention is when you do eat fizzy drinks and sugary foods, if you're having that kind of diet all the time, you can imagine your blood sugar is going to be very high all the time. So the pancreas is going to think that's the norm. So the amount of insulin it's releasing is very, very little. So, you know, for us, if we eat a healthy meal, when our sugars go high, the insulin will go and react to that. But if it's always high, because of your diet, it's not going to work as well. It's going to think that's a normal body thing. So that's another way of looking about it as well. So in terms of diets, there is something called the glycemic index. You can look online, the glycemic index, and that tells you all the sugar, you know, the foods of how much sugar is released with each food you eat. So something like pasta and things like that can release sugar slowly. A cake will release sugar very high. So, you know, it's all about, you know, looking at the diet that you're eating. But that's another topic that I don't want to get into. It's
actually another topic on its own. So we were talking about the causes, actually. You just mentioned obesity and the kind of food we eat, and what other things causes diabetic?
So, I mean, obesity is one of them, which is fat, but also lack of exercise. Now, even if you are underweight or normal weight, but you don't exercise, that actually it's not going to help you getting diabetes, if that makes sense. So actually exercising will help reduce your risk of diabetes, even if you are a little bit overweight, that might help reduce the risk.
So you don't even have to be big before you start doing exercise. It's actually really, really healthy for the body.
Yes, it is.
Because some people really thinking, well, why do I have to exercise? I don't have any fat on my body, so why do I have to exercise?
Because some people have that metabolism, don't they? They can drink fizzy drinks and they don't put on weight, but that sugar's still high in their blood, so they might not be putting on the weight, but it's still not going to be sensitive to the insulin, so they can develop diabetes as well.
I was going to ask that question because I've seen a client that is actually so skinny and she has diabetic, and I was wondering.
So it could be a type 1. So type 1 if she's young. It could be type 1 diabetes. As I mentioned before, they've got no insulin
at all.
So that's probably what's happened. But you know, it is rarer. Obesity is the main causative. But if you've got a poor diet and you are, you know, and you're not exercising, but you're still skinny, you can still develop diabetes. And I have to mention as well, family history is very important.
When you say family history, what do you mean?
So the diabetes runs in families.
Is it hereditary?
There is a hereditary element, yes.
Oh, really?
There's a combination of hereditary element and a combination of environmental elements. So the environmental things are things like diet and exercise and things you can change. But there are genetic predispositions. If your dad has diabetes, you are more likely to get diabetes as well.
Okay, thank you so much. Oh, I didn't actually know that. I never knew is actually if there's somebody with diabetic in the family, you're likely
immediate family.
Immediate
It's
family.
not going to be someone distant.
Okay.
If your mum or dad has it, then you are more likely to, because your genes are the same way you process insulin. So you are. But also remember, those families come from the same diet. So that plays a role.
So you can help yourself in essence, if I understand what you're saying, if the person chooses to start eating differently and change their diet, they might actually escape that.
I've seen families like that. I've seen families who everyone's got diabetes and then someone chose to not eat the same food and exercise and they don't have it.
Well done. That's actually good. So let's talk about treatments now, because I know for diabetic, you've talked about type 1 that they actually use.
Type 1's insulin, because you have no choice, you have no insulin. Okay. So you have to use that.
So the type 2, what treatment do we have for that?
So there's several treatments. I mean, there's a long list. I'm not going to go through all of them.
Of course.
The most, if I saw somebody with newly diagnosed diabetes in my GP clinic, well, the main thing we'd try and do first with them, if it's not too high, the sugars, we would first of all try lifestyle advice. So as we mentioned, exercise regularly, 3 times a week, some exercise. We recommend some 30 minutes of relatively moderate intensity exercise. 3 times a week. Not simple walking, you know, in the house and things like that. It has to be quite brisk walking at the bare minimum, 3 times a week for half an hour.
Half an hour.
And regarding diet, is to cut out. First thing I'd say is cut out sugary fizzy drinks, because they're very bad for you in terms of for your diabetes risk. Things like desserts are not great. Having things that release sugar slowly, like raw materials like potatoes and pastas and rice and things like that, they release sugar slowly through the day. So you burn that slowly, so your sugar's not going to go sky high all of a sudden. It's the quick sugars that you have to avoid.
Thank you so much.
So that's the first treatment. Yeah.
Okay. And if that then work, what is the next stage?
So the next tablet we tend to use is metformin.
Okay.
Which everyone's probably aware of. And metformin works in several, well, there's 2 mechanisms of metformin working.
Okay.
And you can increase the dose up to the maximum, and then you have to start considering other treatments. So the first dose, so metformin works, first of all, the liver can produce sugar if needed. So, you know, in diabetes, obviously we've got sugar in the blood cells, but we can't, in the blood vessels, but we can't get it in the cells. So your body reacts by trying to produce sugar in the liver. And what metformin does is stop that process. It stops you producing sugar in the liver. The second thing it does, it helps reduce insulin resistance. So it makes the insulin work better. So when the insulin released, you get more of the sugar in the cells than you did before.
Okay. So if that didn't work, what else?
So the next things are other tablets again, which work directly on increasing the insulin levels.
Okay.
So they actually produce. So metformin helps stimulate the insulin work better. But there's other tablets like glycosides, which are sulfonylureas, we call them. They're the groups. They actually help to try and increase the insulin level. The problem with those is it can drop your sugar. So whereas metformin, you're not getting. It's not affecting your insulin production, it's just helping more sensitive. But with the other ones, they can increase insulin, so actually all your sugar can go out your vessels and you drop.
Could that be the reason why they normally have this BM check in the morning and in the evening or thereabout to kind of monitor their blood sugar?
Exactly. Well, BM checks are important for people who have the risk of hypoglycemia, which basically means dropping your blood sugar. Let's
talk about that. So which one is hypo, which one is, let's say it in the medical term, then we'll break it down for the viewers.
Yeah, sure.
So yeah, we're gonna be picking up the calls as they're coming in. Hello, you're welcome to the program It Matters.
Hello.
Yes.
Hello, hi.
Yeah. I've got a little information I want to get from you. Because I have a family member that was diagnosed with diabetes, with diabetes. However,
yes.
She started watching food, but ever since the weight has been dropping drastically, and now the doctors are worried that you know. But what I want to know is, can diabetes and thyroid problems?
So say that again, please. So can diabetes what? Sorry.
Thyroid problems.
Can it be linked to thyroid problems?
Yeah, can bring it.
What type of diabetes is it? Is it type 1 or type 2 diabetes? Your family member.
I think with the information I got gathered from you, I think it's type 2, because it's not on the screen.
Right. Okay. So yes, so thyroid problems are not linked really to type 2 diabetes as such. Type 1 diabetes is an autoimmune problem, so you can get other autoimmune thyroid problems linked with that one, but not type 2. Type 2 is usually a lifestyle thing, but with people who have genetic predisposition to it. So thyroid problems, if you do have them, you can drop weight very quickly if you've got an overactive thyroid. That's correct. So has she had her thyroid checked? Yeah. But she's trying to lose weight, you said. Right.
She's already reached the next, weight loss. Yeah, because she's also an elderly lady. So
Right.
the weight is dropping drastically.
Is the most important thing we do in medical land, if you like, is we like to know that the weight dropping is intentional and not unintentional.
It was intentional, but now, the more even though it's eating more, it's still the weight is still losing the weight.
Right. What I recommend you do for, if I was a doctor GP, well obviously I'm a doctor GP working there, I would record what her weights are, so there's some evidence to say how much she's losing and how quick. Because so we actually have something to work with. So if you're telling me she lost 5 kilograms in a week, then I'd be very concerned. If she's lost 5 kilograms in 4 months, I'd be less concerned, especially if she's dieting. So that's really important to do. But I think thyroid checking is very important. And if she's changed her diet, that could indicate why she's losing so much weight. Yeah. No worries. Thank you very much. Take care. Bye bye.
Thank you so much, Kola. Bye. So thank you so much, Kola. So the number you to call is 0774 3475 356. So you can actually please can you please call in to ask your question as we are going. So we were actually talking about the hypo and the
hypos.
yeah. So let's talk about a little bit about that.
So I mean, with diabetes, your sugar will never drop low because you're always prone to having high sugar because you're not using the sugar, with the insulin properly. Does that make sense?
Sure.
So hypoglycemia is a cause of medical treatments.
Okay.
Okay. All of us sometimes when we're hungry, our blood sugars drop slightly.
Okay, naturally.
But we never drop too low.
Okay.
We just get very grumpy, don't we? We get grumpy, you get confused, you can't think. This is the kind of symptoms a hypoglycemic patient, when they're getting hypos, will experience, but more severe.
Okay.
So treatments that drop your sugar are ones that increase the insulin normally. So they produce more insulin.
Okay.
So if it's not titrated properly, especially when you've started a treatment, it could drop their sugar quite significantly. And that's why you need monitoring. Because when you first start the treatment or you change the dose, you never know how that patient's going to react. So eventually they have to check regularly and see how much insulin they need to use or what kind of tablets they need to take to get that level of sugar at the right point. But hypoglycemia can be an emergency, so it's really important that all diabetics are aware of that. For type 1 diabetics, the most important because they're on insulin. So if they take too much insulin, blood sugar is going to go right into their boots,
So for people, that's actually, we've talked about people, how to avoid having diabetic. So for people who already have diabetic, so what can they do to manage it? That's number one question. Then number two, is there any chances of somebody with type 2 diabetic for the illness to just go away with right diet? Because I've seen somebody that said they didn't take medication, they were doing exercise, they were eating right, and the diabetes just went off, and they didn't have to take any medication. So is that really something you've come across?
That's a good question. When you've got diabetes, you are prone to that. Once you've been diagnosed, you're prone to going that way. Just like I said with genetics, you could be prone to having diabetes. You can actually reverse that back to the normal range. So you can do. If your diabetes is very, very poorly controlled, and it's so the level, I'll give you an example, the blood test I mentioned, the HbA1c, if it's over 48, that's what we classify as diabetes. So someone might be 55, the level, when they first come into you, and you tell them to do lifestyle factors, then it goes to 42. And if you hit the lifestyle factors, it'll never go over 48 again. So you can actually reverse it. But say somebody's got 100 level, which is a high level for a diabetic, to go back to normal, it's going to be very difficult. Now it's just about reducing that level to maybe 60, which might be reasonable for them, or 65, because they're never going to get too low because of the way the process of the illness has gone on. You can't really reverse it at that stage. That's why it's really important to get to your doctor early and check these things. But you try and aim for lower sugars, and you try and get better control to prevent long-term complications, which I'm probably sure you're going to ask me. later on.
So let's actually, that's actually a good one. Thank you so much for that. So in diabetic, it's reversible in type 2.
At
normal,
low levels.
At low levels.
Yeah, you, when you first get diagnosed in type 2, you can reverse that process.
If you eat the right
Yes.
diet. And
because remember, the most of the cause is obesity and lack of exercise and poor diet. So if you change all those things, you can drop yourself out of the diabetic range.
We've got another caller. Hello, welcome to Health Matters program.
Hello.
Hello.
Hi. Hello.
Hello. Yeah.
How can I help you?
Hello.
Go on, ask your question.
Can you hear me?
Yes,
Yes.
please.
Yes.
Okay. I would just like to know how often should a diabetic person have a physical health checkup? How often can they have a physical health checkup?
In terms of physical health check, it depends what type of diabetes it is. But normally, if it's type 2 diabetes, you need an annual eye check and your feet checked as well. This is by the NHS, and you should have. It depends on how well controlled this is. So, if you've got a very well controlled diabetic and his sugars are fine, or his or her sugars are fine, you would want to check that. You know, probably maybe every 6 months and do blood tests. I'd say that's pretty reasonable. But if you had somebody who's very poorly controlled and you're trying to get the levels right, you probably want to check him up more often.
Hello.
Hello, can you hear me?
Yes, I can hear you now.
Does that answer your question?
An annual eye checkup and
Annual eye checkup, because diabetes, which we'll probably go into the complications shortly, it can affect, the high sugar levels can affect the eye, so you can actually lose your sight in some patients. So you need regular checkups to see how that's progressing. And obviously with feet checks as well, that should happen annually. But in terms of blood tests, I would say probably every 6 months would be reasonable for a regular checkup of bloods, assessment of sugars and things like that. Unless it's very, very poorly controlled.
okay. What about the medication with regard to diabetes and the insulin? How often? Because sometimes people say they have this issue of not being able, they're not coping with their insulin and things like that. Would they need to see their GP or do they need to
So not coping, what do you mean by not coping? What, to giving the injections? Or? So I mean, it depends again on every case of diabetes is very individual. We do have diabetic nurses now, which are very, very good, and they manage a lot of this diabetes for us. And obviously, that when we can't control it in GP and we're really struggling, or the patient's struggling to do the injections or anything like that, that's when we refer to secondary care. So that's always an option for any diabetic. If you think the GP is not helping, unable to control the diabetes, or you're concerned you're not getting regular checkups or whatever, you could ask him to refer you to the secondary care team, the hospital, and they have an endocrinology clinic and they can help manage that better for you because they're specialists in that area. But most are very easily managed in the community though, but some of them they can, and especially if you're mentioning insulin injections for an elderly person, it's going to be very difficult to do those things. There are risks involved. Sometimes it's better to let the sugar be less controlled than giving insulin, where it can cause a hypoglycemic episode and then they collapse or something. You need to weigh that up. Does that make sense?
Yeah, that makes sense. Thank you so much.
Thank you. Thank you. Bye-bye.
Thank you so much, caller.
Thank you. Bye-bye.
Thank you, bye. So thank you so much. You can still call in. We still got a few more minutes before we round up the program. The number to call is 0774 3475 356. You can call in to ask any question. You don't need to introduce yourself. This is very sensitive issue. We were talking about the causes actually earlier on, and something actually came to my mind. You know, when you have diabetic, some people, they have wounds, ulcer, some people have eye problem. How is those linked to diabetic?
Right, okay. So diabetes, you can have complications with it if it's long-standing, and it's very poorly controlled, your sugar.
Okay.
So only at very high diabetes, the high sugar is not necessarily a problem immediately, unless it's extremely high in a type 1, for example, because that's a dangerous emergency. We call that DKA, or diabetic ketoacidosis.
Okay.
And that's when you have no insulin, your sugars are extremely high. So that's a short-term problem. But in type 2 diabetes, you don't tend to get that, okay?
Okay.
The problems are leaving the sugar at a high level for long periods of time. So if for 10, 20 years, if your sugar's at a very high level, that's when you cause damage and complications. So if you imagine mine and your blood might be more like liquid, like water, if you like. In a diabetic, it's like syrup. If it's severe, you can imagine it that way. So the complications you'd get from that, imagine trying your heart to pump that thick substance through the body. I'm not trying to scare anybody here, but this is an extreme case.
Yes.
You know, but if you're trying to pump that through, it can put pressure on the heart, so increase the risk of heart attack, because you know you've got the vessels in there you'll get blocked clogged up by this sugary fluid, so it can block the vessel, and you can get stroke. So these are risk factors you can get. And then obviously what we mentioned, very small vessels, you can affect those. So the eyes is one area. Small vessels need little blood supply through small vessels in the eye, and they can get clogged up with, if you like, the high sugars. And the sugars actually pour out into the eye area and can cause blindness. But that's an extreme scenario again. That's why you need regular eye checkups.
So does it mean if you have diabetics and you're not controlling it well, that is when you have those complications?
Exactly. Well, the heart and stroke are long-term complications, but short-term are things like you mentioned. If you have a wound, what wound do you think they'll prefer? One that's got, you know, a wound there with no sugar in it, or one that's got sugar? Bacteria love sugar. So
Ooh.
diabetics will love to get infection. Well, they don't love it, but infections will happen to them because the blood contains a lot of sugar, and bacteria love that.
But why do they have the wound in the first place? Is it because most of them, it's not as if they fall down and there was a cut. It's just that you start realizing their skin are peeling off.
So you're talking about ulcers.
Ulcers, yeah.
So that's
in the
again
legs.
the same process we mentioned with the heart. So the blood can't get through to the right area because it's thick. Does it make sense? It's the same as the heart.
So it's like a shortage of flow of...
So yeah, it's not going as quick as it should be. So the arterial supply, the blood supply to the leg, for example, it could be restricted, you know, because it can't get blood into that point, and then you get an ulcer because the area is getting a good blood supply. Does that make sense?
Yeah.
So it's called peripheral vascular disease. That's what we call that condition. So it's
because I've got a lot of clients that I see that as soon as they have ulcer, most of them usually have ulcer, and I was wondering how is diabetic connected to, and it's so hard to treat.
Yes,
when
it takes time to heal as well in diabetics.
Really?
Because it takes a long time. Diabetics take a long time to heal compared to somebody who doesn't have diabetes.
Wow.
So poorly controlled sugars is key to prevent these issues, and as I mentioned, also the wounds, they may not. We talked about ulcers happening when you've not injured yourself, but diabetics can injure their feet and injure themselves without even knowing it, because high sugar levels can damage the nerves as well.
Easy.
So they don't get any sensation in their feet sometimes, so they can walk on glass and not feel it.
Really?
So that's why they can that's why they have foot checks, get their nails cut themselves, not for them to do it properly by a chiropodist.
Oh, thank you so much. So as you can hear from the horse's mouth, all this problem can be averted, you know, if only you eat the right meal. And I'm going to focus more on the African minority, because most of our food are carbohydrates. Let's be realistic. What we eat, especially Nigerians, our food, rice. Even when we were growing up, we were told beans is protein.
Yeah.
Until recently, I got to realize beans is actually 75% carbohydrates. It's not protein. So the beans, when we were growing up, we were told the best beans is actually the kidney beans. The kidney beans is where you can get your full protein from it. But the normal Nigerian beans that we eat, that we're saying we're eating protein, is actually no normal protein. And the yam that we think is fiber, as the way we peel the yam, as soon as you cut the skin off, you've taken the mineral off. So because you know there's this
the roughage, you're saying,
yeah. So as soon as anything that grows underneath the soil, they said the nutrients is actually where is actually anything that grows outside, the nutrient is actually outside. Anything that grows inside, the nutrient is actually inside. So most of the way we cook our food, Nigerians, we overcook. The veg you cook, by the time you wash with warm water, you've washed away the vitamins, the goodness out of it.
Yeah.
So we're just eating leaves. And by the time you eat, you go to the extreme and you go eat our swallow, which is pounded yam, eba, amala. Those yam flour, those pounded yam, those things that we eat are not, I'm not saying they're not good, but you need to eat them at the right time. Most of it we eat very late. We eat around 9, 10 and we go to bed.
That's a really good point. Yes, I mean, obviously I'm very interested in nutrition, but the time you eat the food is really important. And there's that saying in England, eat breakfast like a king, eat lunch like a prince, and then eat dinner like a pauper or something. That's supper like a pauper.
So in essence,
you want to eat most of the food in the morning, and then when you get towards the evening, you eat less. That's a good way to, because you're going to store all that carbohydrate.
Can you please repeat that, please?
Say yes, of
course. Because you know, I have a lot of friends after the show, they will call me and say, you want to kill us? Are we not going to eat again? I'm not saying don't eat. All I'm saying is that eat at the right time.
Eat at the right time, and also do the exercise. It's okay to eat a majority of things as long as you do exercise. It's just the sugary foods you should avoid if you're going to avoid with diabetes. But things like carbohydrates are not that bad, you know, if you're not eating excess of it. And as long as you're exercising, you'll burn a lot of that off. So what we mentioned about the food, eat breakfast like a king. So eat as much as you can in the morning.
In the morning.
Because you're going to burn that energy all day. And then in the lunch like a prince, so a little bit less. And then when it comes to supper like a pauper, you don't eat much in the evening, because where's all that carb going to go? You're not going to burn it. You're not going to burn it. It's going to store as fat. Anything you don't use as sugar, it goes into the body as fat. So that's what you put on the weight. So
anything you don't burn, it goes stocks into the body as fat. And that is where most people, sometimes they say, I'm not eating too much, I'm having tiny bits in the morning. And obviously we're not saying starve yourself, because the more you starve yourself, when you get fed up, you eat extra, and which is really, really not good.
I just want to mention something about that, the starving yourself as well. When you starve yourself, you actually are not doing you any favours.
Okay, let's talk about that.
You have to eat regularly.
Okay.
Yeah? It has to be smaller portions of the right thing, but every 2-3 hours you need to be eating, because that increases your metabolism.
Okay.
So it will help you burn fat. If you starve yourself all day, your metabolism goes slow. You're not gonna burn fat. So people who do dieting and kill themselves, starving themselves, it's not gonna work like that. You have to eat regularly good things. So maybe some melon here, then afterwards maybe eat something else, then something else every couple of hours.
So thank you so much, Doctor.
Yeah.
Because obviously Dr. Adam is actually Nigerian, and I have reasons why I'm actually coming back to the Nigerian meal. So I saw a friend of mine recently, like 2 or 3 weeks ago, and she was like, oh wow, you've lost weight, da 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 da. I said, there's no magic, there's no eating thing, apart from the fact that I was taking a diet coffee. I stopped carbohydrates at a time. I stopped eating a carb food. I was feeding on vegetables and protein more, and that was why I was able to lose weight. And I'm not starving myself. I eat, like you rightly said, every 2 to 3 hours, small portion. If at a point I stopped eating rice, I stopped eating bread, then she was like, oh, why am I going to be eating? Yeah, you can eat. In the morning, have your normal cereal. Then around 12, have mixed veg with a bit of fish or whatever, salmon or whatever you want to do. In the evening, look for something light, fruits to eat. In the night time, I take my coffee and just sometimes just light salad, and that's it for the day. But if you're eating rice in the morning, in the afternoon amala, and in the evening you say I want to eat, and you put beans and yam, or you put bread and stew, obviously that diet is not right, because like he rightly said, when you eat and you're not doing exercise, where do you want those food to go? You go to bed, and obviously, and that's why you see all these problems start when you start adding weight. You start having diabetes, you start having this. So in order for us to avoid all this problem, the best solution is eating the right meal at the right time. And that was why I love that scenario that you made earlier on, saying eat like a king in the morning.
Yeah.
eat a little in the afternoon. That's just
The way you're describing the diet there, that's where you're saying the Nigerian diet. That sounds like a bodybuilder diet because you're eating carbs to bulk up, to get bigger in the gym. You know, that's what we do. We eat a lot of carbs when you want to get bigger. But protein diet, like you say, protein, you have to have some carbs.
Yeah, of course.
Yeah, but
A
you know,
little bit.
protein with vegetable is the perfect. Fish is a very good meal. Fish is very light, and also I was going to say plate size. If you get the plate smaller, you encourage you to
our
have.
plate is so massive.
If you have a smaller plate, you encourage yourself to have.
Our plate. Did you see the one secret? Get yourself a smaller plate.
Then
Get
you can
us-
put more on. Exactly.
And how did it work actually? I did actually try that because when I want to do my cereal, I use my kids' plate. So I put the small portion in the meal. We eat together, and because before I have a massive plate. People that knows me knows I love my food, but I said to people I didn't have any physical problem. I just choose. But the weight rate I was seeing clients in my clinic, and the rate I was seeing people struggling with all these diseases, and I said, you know what? I don't want to get to that stage.
Yeah.
So I have no reason to lose weight. For people that was thinking, oh, maybe she has, I don't have any physical problem at all. It's just that I choose to live healthy and I'm enjoying it. You feel light. You feel great. So before we go, we still got 10 more minutes. Before we go, if you still want to call in to ask question, the number is 074 3475 356. My question, people on diabetic,
Yes.
are they allowed to take alcohol?
So, I mean, obviously everyone has their own rights to take what they want. I would advise, alcohol can drop your blood sugar.
Drop.
So if you are on insulin or something like that, that's going to do, it can drop your blood sugar. So it can go very low levels. That's why alcoholics, if you've seen alcoholics, then they come into hospital, they have seizures.
Okay.
Sometimes that is because the sugar's dropped, often. So it's treated exactly the same. Diabetics can get like that. If their sugar drops low enough, you will collapse and you'll have a seizure.
So I'm confused here because
Yeah.
alcohol is actually, I was told, has a lot of sugar intake.
It does have sugar in, depending on the type of alcohol, but it encourages you to pass water.
Okay.
So because you pass water, okay, it drops your sugar. It has sugar initially, but it drops your sugar. Eventually, you know, if you drink a lot of it, it does drop your sugar eventually, and you pass a lot of water, you get dehydrated. So that's what happens.
So what is the best way? So there's no other. What's the best way for people? The last caller said for people who are diabetic type 1 and they don't want to use insulin. What's the other option?
Type 1, you don't use insulin.
You do?
Well, if you don't use insulin,
What's the worst scenario you've seen?
you'll die. So
Wow.
that's the worst scenario. That's the truth. If
Wow.
when you have a type 1 diabetic who doesn't use insulin, where do you get your sugar from? You were talking about your diet that you were doing, no carbs. You know, have you heard of the Atkins diet or the ketotic diet?
The kids,
Yeah, that's what they're doing. They break their fat to get sugar, and they become ketotic. The problem with doing that is not as good as glucose. When you break the fat to get ketones, to get energy, because you can do that, your ketones go very high. You get very, very unwell. So that's why when people do ketotic diet, they feel tired, they feel sleepy, because they've got no carbs. It's effectively the
So
same.
it reduces their metabolism as well.
Not metabolism, but it's basically you're not using, when you do ketotic diet, you're not using sugar.
Okay.
So you're not putting sugar in your body. The same way diabetics can't use the sugar.
Okay.
So effectively it's the same thing. So you burn fat to make sugar. Does that make sense? So with type 1 diabetics, if you don't fix this problem, they will go to the toilet. The sugars can go over 30, level of 30. Even on the machine, I've seen many times they've come into emergency. I've seen them pretty much, some patients can go unconscious. They're very dehydrated. The sugars are very high. They're very, very unwell, and patients can die.
Wow.
It's quite sad because a lot of type 1 diabetics are not. It's a big diagnosis for life, and people can't sometimes take that.
So it's not reversible, isn't it?
It's not, no, and unless you transplanted the pancreas back in, which is very, very rare
of
that they do
course.
that. But young patients tend to have type 1 diabetes, and they don't accept that condition, so they don't use their insulin, so they're repeatedly in hospital, and it can be quite dangerous.
So type 2, have you ever seen type 2 led to type 1? Is that possible if you don't control it properly?
It won't lead to type 1, but you can get to the point where you're on insulin as well, similar.
Okay.
So you still have insulin, but it doesn't work at all. So you might as well not have it. You can get that in diabetes, yes. If it's very poorly controlled for long periods, but before that will cause a problem, like an emergency like type 1, you would have, if your sugar's that high in type 2, you would have died of a heart attack or a stroke or something before that.
That's actually a bit,
complications, yeah.
very, very scary. Thank you so much for those information. So what is the advice you've got for people who has type 2 diabetics? What would be your clinical advice for them? So
my advice would be, to eat healthily as much as you can. I mean, I'm not saying don't eat, things like cakes and stuff. Everyone needs to have a treat now and again, but it's important to if you have diabetes in the family, or you're prone to diabetes, or you've been diagnosed recently with diabetes, you can reverse that through good exercise. It's important to do that. It's good for your heart. Through dieting, good, not starving yourself, but eating the right foods at the right times, as we mentioned. And they're the things that mainly I'd suggest to you. I mean, it is reversible if you have just been diagnosed at that stage. Keeping your body weight low. Everybody is able to lose weight. I've heard it many times that people think I can't lose weight, but if you eat the right things and you do exercise regularly, you will automatically lose weight, because it's impossible. Your intake has to be less than your, so you have when you eat food, that's a positive. When you have exercise, that's a negative. As long as you're negative every day, you will gradually lose weight.
Which is actually good. So thank you so much for that. We are rounding up. We've just got 5 more minutes to go. If you want to call in on this program, the number still remains 0774 3475 356. And after the show, if you have any personal questions you want to ask us, you can send your questions to info.healthmatters@yahoo.com. info.healthmatters@yahoo.com. You can also come on the page on the Facebook. Your Health Matters page is on the Facebook. We have a group, we have a platform on the Facebook where you're safe to ask any questions, and we have people, doctors, a lot of people, clinicians on the page who will be willing to support you. And like I said, next month is actually August. We're going to be on holiday, and there won't be a program for next month. It's going to be September that will be coming back to discuss any chosen topic. If you have any topic in mind, just put any your question, your query into the inbox on the Facebook, and the admin will attend to it, or you send your query to the email as I gave earlier on. And you can even text the number, the 07743475356, to ask any personal questions. Like I said, this program is, I don't want to know you, I don't need your name. It's just to promote our health, and to make sure everybody stay fit, because it's just all these little things that grow up to be bigger issue. And if you are not careful, before you realize, you're just at the edge, and God forbid you're gone. So thank you so much, Dr. Agdam, for coming on the show today. It was really, really good to have you. I want to appreciate all the viewers today. I want to appreciate my admin and everybody who has shared the video. Please do share, and let people listen to the advice. Diabetic is real. Everyone in every family has it. If you don't have it, check your grandparents, check your uncles, your aunts. You realize one particular person have it, and it changes. As soon as you have it, you're limited to what you can eat. You're limited to what you can eat, and taking medication every day is not something you really want to do. So you can avoid it by eating the right diet. You see, the way I look at food these days, it doesn't even freak me like it used to, because I realize when you eat, you go to toilet, you pass everything out. So why do you have to buy yourself eat to get a problem? And for those people who are on the obesity, don't give up on yourself. Don't give up on yourself. Even if you're size 22, start. Give yourself time. The problem we have is that we want results. People want magic. People want that thing that will just drop the weight. You didn't add the weight in a day.
The best thing to do, I was going to say, is get a diary, of the food and the exercise you're doing, and then you can measure, what's coming in and what's coming out. And if you are a size 22 or something, if you're overweight like that, you will lose a lot of weight, because you're not meant to be at that weight. So it just becomes, while you've got the chance to mobilize, you try and exercise, because sometimes you get to the point when you're too overweight, and then you can't even walk to burn the fat off. So that's a problem. So before it gets bad, that's when you need to really try and reverse the problem, really.
Thank you so much. So don't give up, like I was saying, on yourself if you're obese already, And people around, let us encourage ourselves. You, the husband, encourage your wife to do exercise. You, the wife, encourage your husband who's got those pot belly to do exercise. There are quite a lot of one good thing about exercise, you don't have to go to the gym these days.
Yep.
If you go on YouTube, just power walk. I do it a lot, and you will sweat.
There's classes probably on the YouTube as
On
well.
the YouTube.
And do it as a couple. You can
Exactly.
do it as a couple, get a personal trainer as a couple. They train people together. You can do that as well. So
It's so easy to actually lose weight these days because all those fats are, trust me, they have nothing good to offer you to do in your body. And for anybody who has diabetic, try and eat the right food. Take your medication on time. If you're on the type 1, your insulin, because the worst can happen if you stop it. The worst, like you rightly said, that if they don't take the insulin,
it's very dangerous.
It's very, very dangerous place.
And
so
likewise, if you're taking too much insulin and you're not eating, like an elderly patient, and they're injecting when they're not eating, so that can be dangerous because you're dropping the sugar. You could be living alone, so you have to really weigh it up on each case. It's really important to do that. And I was going to say, in terms of foods to avoid, it's just best to think of it this way. The raw material foods are usually the best. By that I mean the things like fish and things that are natural that you cook. The things that are very bad for you are the packaged foods, like cakes and sugary drinks and fast food. Fast food's cheap, that's why we have an obesity problem. It's a lot cheaper than healthy food, and it's quick.
I think it's a bit of laziness around that as well. You don't have to stress yourself to cook.
Exactly. So it's convenient and it's cheap. Fast food's a lot. If you go to any of these fast food restaurants, it's cheaper than making the food and buying it in and doing it yourself.
But if you weigh the consequences, the side effects of those things, then you want to stay healthy and eat the right food. So thank you so much for joining in today. I want to appreciate my the doctor is already an hour. We are going to stop the program now. Thank you so much, all the audience, and a big thank you to my mother, Prophetess Fumi Ogatimeri. She's been wonderful today. I want to appreciate her for making this. We're unable to go on the radio show today, but when we come back on September, we'll probably be going. Before we go, I want to tell you, Dignity Radio Station is there for you to advertise any program. If you have any show you want to bring on the Dignity Radio, please contact the director on 07853805993, and it's very cheap for any program you want to do, so that we can let people know about whatever your business is or whatever you're doing. Even if it's church anniversary, you want people, rather than you taking pamphlets and posting things around, we can actually make a jingle and let people know about your business and your anniversary. Thank you so much for today. My name remains Labake, also known as Elizabeth. Till when I see you, stay back. The weather is so hot. Drink a lot. Your health matters. Thank you. Bye.